Your internet connection is unstable.
What are you saying?
So there's Viral Dedia, there's Yogi Sakha.
Viral Dedia is Vishal. Watch now.
Vikram, we call Vikram and help him out if he's not able to join. He's there.
Namaste. Hello. Good morning, Vikram.
Hey, good morning, Yogi. How are you?
Great. Amazing. Thanks. How are you?
I'm well, thank you.
Hi, good morning.
Hi, good morning.
So we are live on Facebook. We are live on YouTube, and it's 11. So Yogi, if everyone's okay, we can just begin.
No, on YouTube it's still showing waiting.
Yeah, you tell me.
Take 2 minutes, 2 more minutes.
We'll just wait for 2 more minutes.
Sure.
Sure.
Let's go.
Yeah.
Okay, great.
Okay. Namaste and good morning, everybody out there, our audience and viewers. Thank you very much for joining us on this Sunday morning. Quite warm and sunny outside, but I believe, because of the lockdown, we may not be able to enjoy it as much as we can. Yet still, it's fine. So today we are going to have a webinar which is going to be based on telehealth and digital medicine. Before that, I like to just have a very short introduction about Holistic Care Center and myself as well. So I am Yogi Sakha. I am a holistic health and happiness coach, and I help people transform their health, mindset, and lifestyle using certain principles and a system where I use fundamentals of evolutionary science, nutrition, yoga, mindfulness, and exercise physiology. Talking about Holistic Care Center, which is a unique collaboration of modern medicine along with traditional healing therapies of yoga, meditation, mindfulness, where we have a team of people, a team of medical professionals like doctors, orthopedic surgeons, general practitioners, nutritionists, dietitian, psychologists, psychiatrists, yoga coaches. Uh, they all believe in the whole person concept. And therefore, we believe in the concept of mind, body, spirit connection. At a holistic care center, medicine or surgery is seen only as a last resort and only after a judicious judgment is being made by our medical professional. So moving ahead with our seminar webinar, which we have on digital health and telemedicine, we have two panelists with us. I like to introduce both of them to you. I'll start first with Mr. Vikram Nair. Just a very brief introduction of Vikram Nair. Mr. Nair is the CEO of Purple Health, a company which offers a digital health technologies platform to solve healthcare challenges like affordability, transparency, and accessibility. And our other panelist is Dr. Saurabh Talekar. Dr. Saurabh Talekar is an consultant orthopedic surgeon with an extensive training in hip and knee replacement surgery, and is a strong believer of holistic concept. And that's how we both came together and have started this venture of holistic care. So my first question goes to Dr. Saurabh. So what, according to you, is holistic, and what is that which you're trying to bring over here through your understanding of holistic orthopedic or holistic medicine?
A very good morning. Thank you, Yogi Sakha, for the introduction, and thank you for the question. What is holistic orthopedics? So firstly, I would like to talk about that this holistic orthopedics is not my concept. It is the concept of Dr. John Ebenezer, who's a Padma Shri, who's also our mentor. He has introduced this concept where you do not look at a patient who has come to you with, suppose, a knee problem or a back problem as just a knee or just a back. So what is done in modern medicine, when you go to a hospital with a knee problem, you're evaluated, just your knee is evaluated. Our first principle is to consider evaluating the patient as a whole and understand that a human is made up of different things and not only flesh, bones, and muscles. So the concept is to understand that the human is made up of different things, which is mind, body, and soul. So whenever a patient comes into our clinic, which is holistic care, he gets evaluated completely. Initially, we try to connect with him on all levels by offering him a questionnaire, which is focused on different habits of his daily living. What kind of food does he eat? How much sleep does he get? How much is his water intake adequate? This is concerning the body aspect. There are different aspects like the mind aspect, where there are diseases like stress, depression, which cause a lot of orthopedic problems. But back pain, stress, back pain, fibromyalgias, these are in modern medicine just addressed by painkillers or muscle relaxants, and no one takes care of the stress. A lot of doctors might tell you, you need to fix your diet, you need to exercise, you need to fix your stress, but how exactly do you do this? And there is not enough people who can help you out to do this. So that's what we're doing. Generally, patients come to us in pain. We try to relieve their pain with judicious medications. We try to look holistically at a person and evaluate him in detail. If we find that he needs lifestyle correction, we offer lifestyle correction through our dietitians, our psychologists. We advise them to join yoga sessions, which helps in mind and body healing as well. And finally, if all of these approaches fail, then only we offer a surgical intervention, which is not the case in most of the healthcare setups you see today. So that is the difference between normal modern medicine and holistic orthopedics. And if you ask me how scientific is this, so Dr. John Ebenezer has published a lot of literature on this, comparing techniques which are of modern medicine and comparing holistic orthopedics, and it's always better when you go as a whole. And his treatment protocols are also recommended by the highest authority in orthopedics, which is the American Association of Orthopedic Doctors.
That's really a very innovative and a kind of a radical concept in current healthcare, because what actually we are doing over here is keeping the surgery and medicine as an alternative. So that is something as an option, and here the primary focus is on the lifestyle changes which are driven at the center. That's really great. So my next question is something different, Doctor. It's to you only. So because this is such a new concept in the medical field, holistic care is known to be amongst the early adopters of new tech innovation. So what is that which is new this time?
So to begin with, if you say we have always been using different kinds of technologies, like we have a YouTube channel where every patient who comes to us who needs exercises, some kind of information, because information, when a patient is well informed, he's always relieved of his stress of the specific disease what he's struggling from. So we try to always send them information through our informative videos. The newest thing right now, because of the lockdown, and this is not new, the technology used to exist for a couple of years. If you see 10 years back, if you would go to a bank, what would happen? There are certain clerks sitting doing document work, and they're writing down everything on paper. And all of the calculations used to be in a register. If you go to a bank today, there was a step-by-step change in how a bank used to function. The ATM came in. And now, if you see, almost all of the transactions are happening through your mobile app, through
Indeed.
computers, and you hardly need to go to a bank.
Mm-hmm.
I
Yeah.
don't remember going to a bank for the past 3 months, right? So that is what this technology existed 10 years back when it came to the banking sector. But it has not come to the healthcare sector, or we have not adopted it.
Mm-hmm.
So the same technology of connecting with your customers, your patients, your followers through this technology, we are trying to do it through telemedicine.
Okay.
And it is not recent, but because of the recent events, because of the lockdown, now doctors are forced to use this technology. Now patients are also do not have much of a choice because they cannot get out. They do not want to go to hospitals where there may be other COVID patients where it can be a place where they can get this disease. That's why they're avoiding to go to hospitals. So the safest way right now for non-emergency treatment, and I say this with a lot of emphasis, in case of emergency, telehealth is not our thing.
Mm-hmm.
But for minor disorders, when you need consultation of a healthcare professional, your doctor, your dietitian, your psychologist, your psychiatrist, this is the best way to go ahead, where you can sit at the comfort of your home and connect with the specialist you know. So this is the latest thing. We have partnered with Purple Health, where Mr. Vikram Nair comes in, and they have helped to develop a website
Mhm.
and an app. So the app is very simple for the general population to use. It's as simple as WhatsApp or YouTube, how you use it. You can book an appointment, you can book a video consultation to your with your specialist, which already exists, which you used to go to in a physical clinic.
Yeah, great. Yeah. In fact, my next question definitely now goes to Mr. Nair, and I did use the practitioner app, and I found it so kind of simple in terms of its interface, and uh, I was able to kind of even just try it out with my friends and family. They too really kind of like the simplicity of it. So great, Mr. Nair. Uh, Now moving to telehealth. So very basic question: what is telehealth, and when it comes to patient, how can they get in touch with their doctors using something like telehealth or digital media?
You're asking me. Okay.
Yeah,
Thanks. First of all, thank you for inviting me to your program. I appreciate the opportunity to talk about what we're doing. And just broadly speaking, just a step back, we're seeing how technology, I think Dr. Saurabh has explained how technology is, revolutionizing a lot of industries like banking and other ones as well. And no industry is immune from it. And certainly healthcare in general, there's, I think, a coming revolution in which technologies will impact how or change how healthcare is delivered to patients, and how health professionals like Dr. Talakar will use technology. So I think that's sort of the broad perspective, the high level of what we're looking at. And then in terms of telehealth specifically, yeah, I would say that telehealth is something that people have been using probably before it became recently popular with the recent COVID-19 lockdown. It's something that people have been using informally for a long time now, right? So this is something where telehealth, literally, the tele part of it is like a telephone, right? So where people would call up their healthcare provider or their doctor and ask questions, maybe on a follow-up, maybe just to get some initial information. And they've been doing that for some time now. And I believe that even, the Indian government through the ISRO was doing satellite-based communication, telehealth. They built systems for decades. So, and then, you would get into different forms of it. So it would be telephone, then it would be maybe messaging, like a chat. And all of that's been done, is very common. It's been done for over a decade at least, commonly, I would say. And since the smartphone revolution has come, it's certainly increased a lot. So now you're using WhatsApp, you're using video calls, using like a WhatsApp or a message application. And so I think people have a natural acceptance of the concept of telehealth, because it's being used in other applications for specifically for their healthcare, or it could be used, just to, chat with your family members who may be in a different city or in a different country, right? So the concept of communication is very well understood. Now, telehealth specifically has, I think, encompasses a few things. So you'll have to be able to do more than the simple communication aspect of it, or even though that's the key aspect of it. But there's a few other things in a healthcare setting. So, in the same way that you talk about holistic healthcare, what we try to do is put together a holistic approach to the concept of telehealth, because it's more important than simply being able to connect with a physician or a healthcare provider. You'll need to also be able to, get information. That your information should be put into a healthcare record Now we see that there's a lot of emphasis by the various levels of government in the country to ensure that patients have some sort of healthcare record, which is important so that they can track what's happening. So we've got a clinic platform as well, records keeping platform that integrates to this whole system. So all of that is important. So it's not simply the communication aspect of it, it's the information aspect of it, it's the record keeping. And then over time, telehealth is something that's going to increase and transform. We talk about things like Fitbits and Apple Watches, etc. So a lot of the time you'll be getting data into these systems that will then help the patient learn more about what's going on, will help the doctor stay informed in terms of their existing patients, what's happening with them because of the data that's coming. And then that will create an opportunity to engage with the patient to, follow up on the data in terms of some particular health requirement. So telehealth is a simple word, but I think it's growing in terms of what it actually means in the healthcare context.
Yeah, of course. I mean, the word telehealth sounds so simple that it seems as if you call you a medical professional and that's it. We have been using it for a long time, but currently because of this explosion in the smartphone technology, I believe that is something which is going to be even revolutionary when it comes to using that digital platform. So the next question in this context itself to you, Mr. Nair, is that when it comes to doctor, how would doctor provide prescriptions based on these platforms, and are these digital prescriptions approved or accepted by pharmacies? Any government legislations regarding that? How have you taken care of it as a company?
Yeah, so our system allows for different formats of prescription, and the government has recently released a document talking about the acceptance of telehealth and telemedicine specifically. Okay. And they go through that, and it's been very helpful because they've cleared up a lot of doubt amongst the legality and the appropriateness of it. And the medical council has said that telemedicine and telehealth is an accepted practice now, and laid out very clearly the type of ways of doing it, which include video, it includes call, and even messages as well. And so specifically to answer your question regarding, prescription, you can actually do it in multiple ways. So in terms of our system, we have the ability to accept, you can take a picture of a prescription that a doctor would traditionally write on their pad and use that and send it to the patient. You'd also have the ability on the digital clinic management piece that we have to actually write out the digital prescription and then send it to the pharmacy as needed, or even a lab, etc. So depending on what the doctor prescribes, it may not just be medicine, it could be a test. So that has become an accepted practice now. And again, you can do it in different formats. Our system is designed so that you can do it in multiple ways. But yes, this is something that will become more and more common. And the good thing about this is that, as things are digitized, the record is kept, right? So for both the physician and the healthcare professional and for the patient, they're able to keep a record of what was prescribed before. Otherwise, you sometimes can lose, prescription and information. And the ability to have a healthcare record as part of the engagement and, in telehealth becomes more and more important over time. So prescriptions and these type of, information, whether it's a lab report or anything else, it's all enabled.
Great. So Dr. Talekar, do you have anything to add on this based on as a medical professional your experience, and especially this current COVID-19 scenario? Anything from your side, your experience?
So if you see, people have been connecting with their doctors for a long time for minor queries through phones, through WhatsApp, through video calls. It's been happening, but it was unorganized. A doctor would get a call at any time. He would write an SMS. There may be a typo mistake, and a small typo mistake on an SMS can like make a drastic effect on the medication taken, a wrong dosage of medicine prescribed. So this is an organized, a safer way of doing it. So now when you do it on this app, the prescription format is become so professional. One is writing it down and just sending a photograph. That is a little conventional. What the Purple Health platform offers is also a digital prescription, which makes the time of writing the prescription smaller. So a physician takes lesser time to write a prescription because it's digital, and it avoids any kind of mistakes which can happen on typing and sending a prescription. And earlier, before this lockdown, all of telemedicine, all of this was not so welcomed by the government. So as soon as the lockdown was implemented, we have seen the government coming out with new regulations and specific directives on how a doctor should prescribe, what is allowed, what is not allowed. So it's become clear, and only medications which are X graded, which is medications which can cause like neurological side effects, or which are opioids, they are not allowed to be prescribed. But simple medicines like antibiotics, painkillers are prescribed.
Okay, so there is a certain judgment which needs to be kind of made even when prescriptions of a drug or
there's very clear guidelines. There's very clear guidelines in terms of what is allowed, what's not allowed, and the circumstances of what's being allowed. So I think there's I mean, Dr. Talakar will be more of an expert, but there's 3 levels basically. You know, there's OTC, then there's things like antibiotics, and then, as you said, there's things that are completely regulated that you should not do over, you know, a typical thing. And also there's regulations around the patients, whether you've seen the patient before or not, you know, et cetera. Do you know who the patient is? There's some very clear guidelines, and as Dr. Talakar said, it's actually been very helpful that it's been very, you know, cleanly laid out for everybody to understand. So that's important for everyone.
Okay. So Dr. Talekar, when it comes to the choice of you know, the platform which you thought you would be using as a company, as a startup which you started, you always had a vision of you know, putting the best in terms of the software, the e-reach through the services which we can do and provide to our clients. So what was the reason behind choosing Purple Health for you know, something like this, where we are using the platform? What is that which does it go beyond holistic care? Are you associated with him in any other ways where you found his services earlier and experienced?
So we have been associated with Vikram's company, Purple Health, since about 1.5 to 2 years. I have worked with him on a similar project with my teacher, Dr. Vijay Shetty, on a project called Orthopod Online. So it was a platform made by Purple Health just for orthopedic surgeons. So what I liked about these platforms is there are 2 ways of looking at it. One, from an aspect of a patient. So the software for the patient is made so simple that anyone who is used to using these apps like WhatsApp, these YouTube, Facebook, can easily use these platforms.
Okay.
And if you look at the other part, the doctor's part, it is a little difficult to use. It consists of various things. It has a learning curve on how to use it, but a doctor will learn it in about 15 to 20 days and get used to it. And once he's used to this platform, it can manage various things. One is your reception, which is appointments. All the time I see the waiting time for me is practically 0. You come to my clinic, you see me. That is
Okay.
what has been provided by this platform. Second is the prescription, the e-prescription. They are like precise. Earlier, you used to get various kinds of queries from all kinds of pharmacies. I cannot understand the handwriting of this doctor. What's written here? There is confusion regarding prescriptions. So this has been taken care of. Earlier, people used to, all the transactions used to happen in cash. So right now, everything happens through a payment gateway. If you are on the internet, everything can be done online. So there is the accounting struggles of a doctor are also sorted. So at the end of the month, you just get a report: how many patients you've seen, how many, what have you charged for it, and these are the basics things what we are using. The platform which Popal Health provides, it has numerous other implications which I have not even used, which I think
Oh,
Mr. Vikram can like
yeah, sure.
express in detail.
And maybe he can also give some training on us to to help it use in a better way. Yeah, my next question is to Mr. Nair. Uh, when it comes to the security and the privacy aspect of both the data and related to the client or the person, um, how safe sound is this system which you have developed from that perspective?
Oh, it's very safe.
Mhm.
Let me just step back at the risk of shameless self-promotion, but just
Yeah.
to speak to what Saurav said, I appreciate very much Dr. Talakar's use of our technology. And certainly it's something that we appreciate, and we work very hard to make it useful for both the patient as well as the physician. So as he said, that we have what makes us a little bit different is that we have something that is designed for individual clinics and practitioners. And it's not simply like an aggregation platform where anybody goes and the doctor is sort of anonymous. We actually have mobile apps and websites that are on the patient side. And that's what I mean by we have a holistic approach. So the patient would go to that clinic, that doctor's interface, whether it's mobile or on the web, and then be able to engage in the various, telehealth opportunities. And that integrates back into a robust and full-fledged clinic management tool. And like you mentioned, we have a lot of features and services, but it's actually something that's configurable. So everybody's different. So a lot of doctors only want very few things, and then we can configure that to just show that. And some people want a full management technology for their operations, as well as not just healthcare records. So just to give a fuller description of what we do. But and that's not to say that we're doing something that I think this is a space that there's a lot of great technology. It's an explosion of new ideas from a lot of great companies. Our approach is, like I say, more holistic in terms of what we try to do. And I think that's what makes us a little bit different. But to answer your question about security and privacy, this is something that we take very, very seriously. We follow all the best guidelines in terms of technologies, in terms of security, especially. We use all the best protocols and the standards that are publicly available. We follow that, and the technology, like things like the hosting, etc., follows those type of requirements, like AES 256, which is an encryption standard for the storage of the data itself. But there's another aspect which is very important, which is privacy. And you can still be secure and not necessarily very private. And we take privacy very seriously. So for example, there can be platforms in which, people join, and then they suddenly get a lot of, messages and emails suggesting, check out based upon their specific issue. Suddenly you'll get all these other providers or, services that are marketed toward you. We don't do any of those things at all. We're very clear about that. We don't market, other people's technologies, other people's services or labs or pharmacies to patients in any particular way. We don't do any of those type of things. So I think privacy is something, because we don't have that type of advertising model in our system. That's not something we intend to do either. So that's something that we take seriously as well. So I think both those elements are important, especially when it comes to people's health, and it's not just security of data; it's more than that.
Indeed, yeah. So the next question to you, Mr. Nair, is because this is something which we hear, in India, what we're going to see like a digital revolution going to happen in the coming decade, and especially this COVID-19 condition has actually, you can see it as a boon for this particular aspect to grow as well. What can we expect, in the coming days from your company and what you have to offer?
Well, I think in general, I'll leave the self-promotion behind for now, but
okay.
In general, I'll talk a bit about what we think we'll do. But I think in general, what the future holds for healthcare in terms of some of these technologies is actually incredibly exciting. I think we're just on the verge of wholesale changes in a lot of areas. And this doesn't take away from the importance, actually, even though there's going to be more technology, it doesn't actually take away from the importance of the human element, which is very key in healthcare. And it doesn't take away from all the people, healthcare professionals, whether they be frontline workers or physicians, like Dr. Talakar as well. That doesn't change at all. And in fact, in certain ways, it becomes more important to make sure that the human element is there. But just in terms of the pure technology aspect of it, it's very, very exciting because, even if you look at just what's happening with, say, telehealth specifically, the fact of the matter is in a country as large as India, there's a lot of regions, and this is true world over. There's a lot of places in rural areas where you get a lot of underserved patients, underserved people. And how do you reach those people? Because the fact of the matter is, let's say a specialist like Dr. Talakar may not be there, right, in some parts of the country, right? Or you may not have the exact specialty that you need. That there may be other specialties that you need. You may need a second opinion. You may need to, talk to somebody else or get more information. Telehealth, as it becomes more broadly adopted, so the technology is here now, but as it becomes more broadly adopted, I think it can have huge and significant impacts in the underserved and rural areas, which I think is only just starting to be understood. So people's lives will be dramatically, I think, improved as this technology, scales and becomes more widely adopted. So that's exciting, and that's with existing technology, right? So, but going forward in the concept of digital health, I think I touched upon the fact that as we get more monitoring devices, whether for say diabetes or for some other ability to monitor, and the technology is becoming more and more amazing. A lot of this data will be captured and then put into systems that will inform the doctor or your healthcare provider, what's happening, and proactively, help you as an individual know what's going on. And that, I think, is the next change that's going to happen. Like I mentioned, that people have Fitbits or healthcare trackers, or phone watches now, or even your phone can help you monitor what's happening with your health. And that is going to become, I think, a bigger and bigger thing that happens over time. And just the ability to, keep your data and track your data over time, and technology that helps you understand that becomes more important. So you'll be able to start, tracking your weight, which is something which we can do now. But then you'll be able to track, things that are happening with your reports over time, and see what that looks like, some sort of graphical analysis that can help you, go forward. So I think the whole broad space of digital health is growing, and I think telehealth is a key aspect of that. And a lot of that, is something that we ourselves will be participating in. We've already started with devices, for example, that can connect with a smartphone that can capture data for you and then put into a healthcare record that a physician, 2,000 miles away, 2,000 kilometers away can see, and then provide information and recommendations to a patient that can be completely, in another state and far away, and provide very valuable and important advice and information. So that is something that I think is going to become more and more common. I think it will dramatically have profound impact potentially for many people who don't have access to healthcare at the level that they need or desire. And I think these technologies are areas that we'll be exploring more and more ourselves in terms of Purple Health. Mm-hmm. And it's something that, again, it's not necessarily telehealth directly, but is complementary and adjacent to it. And all of these kind of pieces have to fit together and integrate. So that's, I think, the future. I know Dr. Talekar may have some ideas on that, but that's where I'm excited about.
Yeah, I mean, as far as the scope of this particular technology reaching out to the masses is concerned, that is one way which we can look at it. Another important factor which you mentioned, it was about tracking data and the parameters which needs to be actually tested and understood both by the person, client, and also by the doctors. So this is where I believe it becomes even more exciting and interesting, and especially to someone like a medical professional. It is said that in medicine and science, what you cannot measure, you cannot manage. If people have to manage their health in a better way, then they need to have these kind of technologies through which maybe there is an ease in monitoring the various health parameters. Yeah, Dr. Talekar, do you have anything to add from your side? How exciting do you see this playing ground for you and the company?
So I think we just in the beginning of this new era of digitalization. I can see millions of different ways how computers won't take over, but there will be one healthcare provider who is trained well in medicine. Even the training of this healthcare provider will be better with all of this technology. And the practitioners who adopt to these technologies and have a good balance on how to manage your patient with using all of this, they are going to be the best people who are going to be the future doctors, who are going to be have the best quality of care.
Mm-hmm. Great. So in that regards, I have another question coming to you, Dr. Talekar, that when it comes to the process of verification of doctors, how does it take place? Something on this platform.
So this is very different from other platforms which you see on the internet. Firstly, if you just try to search a doctor for an online consultation, you will come up with a lot of websites where there are doctors which you can consult. But the doctor-patient relationship has always been of trust. So there are always doctors who a patient prefers to go to, and a patient doesn't mind waiting for that doctor. There is a lot of anxiety in patients if it's a doctor on the internet who he's never heard of, he's never spoken to, and this is the first time the doctor is having a video consultation. So there's a lot of anxiety in these patients. So how this platform is different is we're not an online provider of doctors. We are a clinic which physically exists, which has a verification process. There are various councils, like for physicians, there is the Medical Council of Maharashtra, or there is Indian Medical Council. So all of these organizations have registered practitioners which are allowed to practice in specific areas of India, in specific states, and any healthcare provider, before hiring a person, can check if the healthcare provider he's going to hire, if I am supposed to add a doctor to my list I can go on these website and check all of the details of registration about how true the degrees what he possesses they are. So it's not a quack. It's a legitimate, genuine doctor, and about his track record. If there are some pending cases or anything like that, in very rare cases you find those. So we have adequate information about this. Except doctors, for dietitians, there are organizations like Indian Dietitian Association, IDA. There is OTPT Council, which is Occupational Therapy and Physiotherapy Council for physical therapists and occupational therapists. So Indian healthcare is organized. These are organizations of the government which provide adequate licensing, and they also provide clinic owners or healthcare setup owners like me to verify these doctors, the legitimacy of these doctors. And luckily for us, it happens on 2 steps. So before taking a doctor on board at Holistic Care, we will personally verify all of these details. And if we tell, suppose Vikram's team to add that doctor on their platform, so they verify it on their side. So it happens twice.
Okay, great. So there's no question of any ambiguity and any kind of fraud which can happen in that sense.
Yeah, that's right. I mean, as Dr. Talukar said that, we are a technology provider, so we expect that the clinics that we work with, do their job in terms of making sure that they hire only correct people. But we also, on our side, make the extra effort as well, especially when it comes to medical doctors, to check their medical registration, that they actually are who they say they are when we put them online for available for teleconsultation. So we do make that effort. Yeah.
So this question, the next question is for both you, Doctor, and Mr. Nair. So what about this thing called as second opinion, and how is this platform going to help get that kind of a medical second opinion from both doctors' perspective and Mr. Nair? So first, Dr. Talukar, can you just briefly talk about that?
So what is a medical second opinion? So this is something very recent, and it's a very good practice. If you go to and again, to emphasize, this is not for a case of emergency. If you go to a doctor, suppose with a condition which is not urgent, which is not an emergency, and you are proposed some kind of a treatment, which can be a medical treatment which is complex, like how you require in cancer patients, which is a chemotherapy or a radiation therapy, which will go on for a few months. Or maybe you're offered a surgery, like suppose you have knee osteoarthritis, Sandivat arthritis, and you go to a practitioner, and the practitioner tells you you need a knee replacement. Or third example can be you go to a clinic with a surgeon, and he's evaluated you well, and he thinks you need a spine surgery. So all of these things are not urgent. These things are not do not demand treatment at the same moment. Mm-hmm. So you have a chance to go to another practitioner and ask for another practitioner's opinion. And you want to check if the first opinion coincides with the other. There are also things like India is not a public health setup, so most of the patients are paying from their pocket. There is a very small amount of patients who are paying through insurance, but mostly now in small towns and rural areas, people are paying from their pocket. So there's always a cost thing involved. So how much does a knee replacement cost in ABC hospital? How much does a knee replacement cost in this hospital? What are the pros of this hospital? What are the cons of getting it done in that hospital? So these are questions which can be addressed through telehealth. Okay. So because when you've taken the first opinion, when you've physically gone to a clinic, that doctor has evaluated you, he's physically seen you, he's written his opinion down on his prescription, his paperwork, and he's also evaluated you in different ways like x-rays or MRI scans or blood tests or whatever. And you already have these all reports in hand, you have a diagnosis in hand. So it is not what it is. It's not about diagnosing. It's about the treatment offered. So when you go to another practitioner for a second opinion, that can be definitely done over a teleconsultation where you can send this second practitioner your reports, the opinion of the first practitioner, what his opinion was, and you can always discuss things out. What are the variants as per the second practitioner which is involved, and also the cost.
Okay. Anything you would like to add, Mr. Nair, specifically regarding this aspect we are discussing?
I think Dr. Talakar summarized that pretty well. Obviously, as a technology provider, we facilitate all these type of things. So,
Okay.
you know, in terms of our technologies and services, we have, you know, the ability to make a video call or a message chat or even an email consultation with a physician. So, in a second opinion scenario, you know, as mentioned, the patient would probably send some report over to that physician to get additional advice or information. So, you know, our system certainly would facilitate that.
Yeah. So the next question would be, you know, what would be the kind of categories of medical professional you see, like these services which they can avail? Do you see that this is something which every medical professional can use, or there are certain, you know, limitation when it comes to the category as well?
So this question is to me, right?
Yeah.
So we've been using this technology for quite some time now, and we've noticed that there are some specialities where there is no barrier as such. If you consider these platforms, when you make, suppose, for example, if you make a video call to a dermatologist, which is a skin specialist, how do they examine a patient? If you have some skin issue, if you have a skin lesion, just take a photograph of it and you send it to your doctor, and he knows what it is. There is no investigation involved. Like a contrast, if you see, if there is a chest physician or a cardiologist, they always want to listen to your heartbeats. They want to listen, auscultate to your lung sounds. So that is not possible right now. Technology is been made to get through these barriers, but specialists like radiologist, dermatologist, psychologist, psychiatrist, then dietitians, nutritionists, all of these physiotherapists who teach exercises, which are therapeutic exercises. So these platforms are very good for these specific specialists because as such, the physical consultation is not giving you much more information than compared to a video consultation. But if you say chest medicine or something like neurology, where you need to evaluate a patient in detail, so there are some barriers in these fields. If you ask me, how is it in orthopedics and what do I do? How do I practice? So the first time when a patient comes in to my clinic, usually my evaluation of that patient is very detailed. So joints are evaluated physically. So I prefer seeing the patient for the first time physically. But after all of these consultations, I usually ask them for some kind of a scan, some kind of X-ray, some kind of blood test. And what happens in other healthcare setups is the patient has these scans, blood tests, X-rays done, and then he again has to take an appointment, again wait outside the clinic in a queue, and this time is saved. So follow up with me is when you sit at home, you send me all of these reports, and it's over a call, it's over a video consultation. So that is one, and is also case specific. So there are minute things which you just need a small opinion from a doctor, but you still have to go to a hospital, stand in a queue, like heel pain or ankle pain. This can be definitely dealt with, and especially in the case of the lockdown, we should avoid going to the hospitals for these minor things where there is a chance of contracting this disease. It's always better to get on a video call and sort these minor health issues out with video consultation.
Yeah, that makes really a kind of a common sense over there, especially in this time.
Yeah.
So
I'll
sure.
just jump in. I think you know, I think certain things are obviously better if you're physically there. I think most doctors or physicians would say, like certain consultations, especially early consultations or the initial one, it's better if the physician is there for certain types of scenarios or certain types of health issues. But you know, other ones are fine, you know, as well. Like maybe certain things in dermatology, as Dr. Talukar said, is you can do pretty well and with very little difference. But I would say also, though, that technology is evolving very quickly, and more things are becoming easier to do with you know, telehealth technologies as well. And you know, in the specific example, you know, a cardiologist, well, we're working with a tool right now that can capture, you know, a stethoscope that captures the information and can send it into a patient record that the doctor can view almost in real time in terms of a heartbeat. Now, these technologies get better over time. And so even for cardiologists, you know, there's certain things that you'll be able to do now going forward, especially, you know, in the near future, that you could not do before. And it'll record your heartbeat, or it'll give you a real-time ability to listen to it. So it's getting better and better. And again, like I said, you know, what's the line between telemedicine and something like that? Basically, it's all one related system that has to integrate. And then the expert, in this case, the doctor, would be able to make a call. So it'll improve over time as well.
Yeah. So I believe we've got few minutes left now, but we'll have this last question, in fact, from you know, the crux of the business aspect when it comes to how about the payment platform? This question is to Mr. Nair. How is it managed on this?
Well, our system basically lets the physician decide what they want to charge, how they want to do it, and then we use a payment gateway, a good one. We use Razorpay in terms of our gateway that helps process the actual transaction for payment. Now, depending on the physician, some physicians don't charge for certain things, and so they may just let the consultation go, or it could be something that they decide to charge. But it's a secure payment gateway. It's using, again, all the leading technology, and it's well established. So, you know, if you've ever bought anything online, the process is no different. So there should be no issue for the patient that way.
Okay. Anything you'd like to add in short, Dr. Talekar, about this in terms of the change which your clinic, the center has made as far as payment is concerned?
So it has become a lot simpler, and even for the government, what Mr. Narendra Modi is trying to do, digitalize everything, to organize everything in this sector. Now everything will be official. You cannot take cash. You will always have to do a online payment, and that will only be better for accounting, better that all of the services reach the poor and the rich people at the same level. So it will get standardized in the future, and I am not the specialist to talk about digital payments, but this is what has come in through telehealth to this sector.
And I would add just one other thing, like there's other ways of payment. It may not just be a transaction like on say Flipkart or something like that, where you're just paying with your credit card or your bank card. It could be insurance based as well, for example, where you're able to pay through, you have a policy and it's taken care of through that. So the systems are all integrated. On our side, we work with a large insurance provider as well, who allows us to do that, where there's, there's integration. So that's all possible, and it'll be more and more common going forward. I think there's a question for Dr. Talekar about veterinarians being part of the holistic care platform.
Yeah, so we got a couple of questions, and this last one is quite interesting. It says, is there any scope for a veterinarian to be part of holistic health platform?
So I think Vikram should take this question.
Well, it's your platform. If you allow us to put a veterinarian, we're happy to do it. But in all seriousness, there's lots of I think research and information on the fact the value the pets have on the human psyche, right? So, and I think because you guys are a holistic platform that looks at everything, from emotions to spirituality to the physical healthcare itself. I think people's pets are something important in their lives, right? So if you allow it, we're okay to it, So,
so I think Mr. Vikram can help you out, make a specific customized thing for a veterinarian.
Yeah, why not, right? The animal can't talk, but the pet's owner can. So that actually might be a great idea. Actually.
Yeah,
you know what? I think that's a great idea. I think we should look at that seriously.
Especially it will be a great hit in the Western countries.
Even here, even in India, I think it would be popular. To be honest, yeah. I think this is a great idea. In fact, I think, you know what? I'm going to talk to my team about this. I like this idea a lot.
That's great. So thanks, Shraddha, who asked this question. Then we had couple of more questions.
Thanks for the questions.
Yeah. So there is something which
if I can. Mamta Gupte. So the question is, I'm not very tech savvy. Is telehealth right for me? So I'll try to answer this one. So Mrs. Mamta Gupte, I think if you have logged in to Zoom, I am sure you're using WhatsApp. Just try using this platform, Holistic Care Clinic, and I think you will be definitely able to use this platform. It is made for people to understand who are not from a technology background, who are not like young. It's very simple to use. And if there are any queries, you can get in contact with us and we can help you out.
Great.
Yeah, absolutely. If you can use Zoom, I think you should be able to use this type of technology. So, I agree. Yeah.
There was one more question. Phone per back pain ke baare mein. Do we have any consultations which can be done on telephone for backache, back pain? I believe, doctor, you can comment on it. Something like this can be diagnosed.
So, if it's considering the current situation, I would not suggest visiting a clinic physically for back pain. Video consultation will be a very good method. What can happen if someone consults me for a back pain through a video consultation? 95% of the time, back pain is just mechanical back pain, which I will be able to ask some particular questions to understand if it's a non-complicated back pain. If it's just a common back pain, mechanical backache, I can definitely treat it through teleconsultation. After asking you certain questions, if there are certain signs which I notice, which are alarming, then I would definitely suggest that person to come down to my clinic and I would want a physical evaluation.
Mhm. Yeah, that makes sense. So I believe all our viewers and audience who asked questions got a satisfactory answer from our expert panelist. And with this, I'd like to conclude our webinar for today. So I'd like to thank Dr. Talekar and Mr. Nair for participating. And thank you very much, the audience and viewers as well. If you got anything final words which you have to say, Mr. Nair and Dr. Talekar, please go ahead. Yeah, Mr. Nair.
No, thank you very much, Yogi, for the opportunity to talk with you and Dr. Talekar for inviting me. I appreciate that. I think, like I said, I think this is going to be a bigger and bigger part of the future of healthcare in terms of these teleconsultations and broadly digital health technology in general. So I think that this unfortunate, the COVID-19 scenario that's happening is actually will probably accelerate that by quite a bit because I can tell you as an organization, we're getting a lot of doctors calling us to ask about the technology. And I think a lot of patients will find this type of technology to be very helpful going forward, just because it simplifies certain things in their life, right? So ultimately, technology is supposed to help you. So no, thank you for the opportunity to talk with you both, and I'll hopefully talk to you soon.
Yeah, Doctor, anything from your side?
Yes, thank you, Yogi ji. Thank you, Mr. Nair, for being here today. It was a great session. Lastly, I would like to tell our viewers that yes, this is a little bit off topic, but if there is any case where you need to consult with us, our physical center is functional. We are adopting to newer things and we are trying to make it safer for patients and for the staff and the medical practitioners working with us. We are also making an initiative to train small clinics around us so that the doctors are provided with adequate amount of equipment to protect themselves so that they can serve more and more people. And this is part of the social responsibility of holistic care. So thank you very much, Yogi ji. Thank you very much, Vikram.
Yeah, thank you. Thank you both. I'll just add one thing. If you have a doctor that you'd like to talk to using telehealth, please do contact us at purplehealth.com. So thank you.
Great. Thank you very much.
Thank you.